Ladies and gentlemen, please welcome Dr. Todd Strumwasser, Head of Operations, San Francisco Bay Area for Dignity Health.
Thank you. Good afternoon. Dignity Health is proud to be a supporter of the Bay Area Council and the Outlook Conference, and I'm honored to introduce our next speaker. At Dignity Health, the words "Hello Human Kindness" are not a slogan. We hold ourselves accountable and we walk the talk. This next speaker personifies human kindness and the work she is doing with children. And I'm honored to introduce her. Dr. Nadine Burke-Harris founded the Center for Youth Wellness in San Francisco in 2012 to focus on one of the most serious public health issues of our time, the impact of adverse traumatic experience that have on children and how this affects the opportunities they have to succeed in life. Through the Center for Youth Wellness, Dr. Burke-Harris is working to change the standard of pediatric practice by creating a clinical model that recognizes the impact of adverse experiences on health and effectively treats toxic stress in children. These experiences stem from a variety of causes and can lead to a lifetime of health problems and diminish the opportunity for future generations to contribute fully to our community and our economy. What I love about this is it's proactive and it promotes wellness. And these are principles that Dignity Health holds dear. We are similarly focused on the importance of human kindness, compassion, and respect in providing a healthy environment for children and families. In addition to her work at the Center for Youth Wellness, Dr. Burke-Harris is an expert advisor on Hillary Clinton's Too Small to Fail initiative and the Clinton Foundation in association with Next Generation. She serves as an advisor on Governor Jerry Brown's Let's Get California Healthy task force and as a committee member for the American Academy of Pediatrics Medical Home for Children Exposed to Violence Committee. And Dr. Burke-Harris's work earned her the American Academy of Pediatrics Arnold P. Gold Foundation Humanism and Medicine Award. On behalf of Dignity Health, please welcome Dr. Nadine Burke-Harris.
Thank you so much. It is such a pleasure to be here. Hi, Bernard. I really have to say a huge thanks to Jim Wunderman for giving me the opportunity to talk about my passion and the work that we do at the Center for Youth Wellness. And I will say, I'll talk a little bit about how I came to this work and a little bit about, what the heck is this thing, adverse childhood experiences and toxic stress. But before I do, let me do a little quick show of hands. How many people have heard the term adverse childhood experiences? Wow. I just have to take a moment and pause. And how many people have heard the term toxic stress? So I will say I'm a little bit blown away because you do this work and you feel like you're shouting in the dark a lot of the time. And I've been, in rooms this size and asked that question of healthcare providers, and no hands are going up. So it's incredibly heartening for me to see this. But I came to this work honestly, in 2005. I finished my residency training at Stanford. And I've always been incredibly passionate about serving underserved communities. So I came to work for California Pacific Medical Center, and all of my friends laughed at me because they were like, we didn't know CPMC had an office in the hood. But it was funny. After looking at the health data, we opened a clinic in Bayview-Hunters Point in 2007. And the focus was addressing health disparities because at the time, a child born in Bayview-Hunters Point had a life expectancy that was 11 years shorter than a child born in Russian Hill. And despite the fact that San Francisco has one of the highest physician per capita ratios in the United States of America, Bayview is still a federally designated underserved neighborhood. Medically underserved community. But we opened the doors, the CPMC Bayview Child Health Center, and we hung a shingle, and as we were in construction and preparing to get the clinic open, I did a ridiculous amount of outreach. So I went to schools and churches and after-school programs and said, hi, I'm Dr. Burke, and this is before I was married, and I said, we're opening a clinic here in the community. Please send us your kids. And the funny thing that happens when you say, please send us your kids, and you sit through 3 back-to-back-to-back church sermons, right? So you can get up and say it at the end. And you actually go door to door in the Potrero Hill Project, is that people believe that you're for real. And so they sent us their kids. And they sent us their kids saying, please, Dr. Burke, can you care for Bobby? He's fallen out in class. He's hitting the kid next to him. He can't pay attention. Please, Dr. Burke, he's got ADHD. Can you put him on some Ritalin? And I said, well, send him on down, and I'll take a look. But when I did my job, and I actually did a thorough history and physical, what I found was that for most of the patients that I was seeing, I couldn't make a diagnosis of ADHD or attention deficit hyperactivity disorder. For most of the kids that I was seeing, I was hearing these really, frankly, terrible histories of adversity, and it just seemed like there was something else going on. So let me tell you, I'll step away from the podium here for a second. Let me tell you, oh wait, but then I go, okay, that if I worked in a community where there was a dramatically disproportionate level of autism or a dramatically disproportionate level of tuberculosis, I promise you I would be an expert in autism or tuberculosis. But for the patients that I was seeing, their exposure to adversity seemed like their single greatest health risk. So when I dove into the research about how adversity affects the developing brains and bodies of children, the day that my colleague walked into my office and said, have you seen this? And in his hand was a copy of the Adverse Childhood Experiences Study. I will tell you, let me just say that when I read that study, and I don't know if you all remember the movie The Matrix that came out in the 90s, it was like that moment at the end of The Matrix when Neo sees the whole universe and the ones and the zeros, and he figures out holy mackerel, I see how this is all put together. That was what that moment was like for me. Now, let me tell you what this phenomenal study said. Let me tell you. This was a study that was done by Kaiser Permanente and the Centers for Disease Control and Prevention. And what they did was they asked 17,500 people about their histories of adverse childhood experiences. And they included specific criteria: physical, emotional, or sexual abuse, physical or emotional neglect, having a parent who is mentally ill, substance dependent, incarcerated, parental separation or divorce, or domestic violence. And for each yes, you get a point on your ACE score. What they found were 2 things that were incredibly striking. Number 1, ACEs are incredibly common. 67% of their population had at least one adverse childhood experience, and 12.6%, 1 in 8, had 4 or more adverse childhood experiences. Now, this was not Bayview-Hunters Point. This was Kaiser San Diego, and this was a population that was 70% Caucasian, 70% college educated. But the second thing that they found was a dose-response relationship between adverse childhood experiences and health outcomes. The higher your ACE score, the worse your health outcomes. For folks who had an ACE score of 4 or more, their risk of chronic obstructive pulmonary disease, COPD, was 260%, 2.5 times that of someone with an ACE score of 0. For stroke, it was 240%. For diabetes, it's 160%. For cancer, it's 190%. For depression, it was 460%. For alcoholism, 740%, 7.4 times as likely to be an alcoholic if you have an ACE score of 4 as compared to someone with 0. Right? So when I saw this data, let me just add, I just have to add this point, that if you have an ACE score of 7 or more, right, we see this dose-response relationship. So if you have really high dose, if you have an ACE score of 7 or more, your risk of ischemic heart disease, the #1 killer in the United States of America, is 360%. That's higher than if you smoke. That's higher than if you have high blood pressure. That's higher than if you have high cholesterol. Right? Your risk of lung cancer is triple, and the difference in your life expectancy is 20 years. So you can imagine that when I read this research, and particularly looking at the community that I was serving in Bayview Hunters Point, I was just like, wow, we need to be doing something about this. So the first thing that we did was just looked and said, OK, how much is this even an issue for our patient population? So we, sure, the Kaiser data says that it's a big problem in their population. But who knows? Maybe Hunters Point is exempt. No. Let me be scientific about it. So we did a retrospective chart review. And what we found was when we looked at the charts of 702 patients, our data was very much like the Kaiser data. 2/3 of our patients had at least one adverse childhood experience. 12% of our patients had 4 or more. But the difference is that unlike the Kaiser study where they asked adults which of these things happened to you before the age of 18, in our study, the mean age was 8. And what we found was that for our kids, if they had 4 or more adverse childhood experiences, their risk of being overweight or obese was double, and their risk of having learning and behavior problems in school was, take a guess. Anyone, venture a guess? 4 times what? 5 times, 6 times? 32.6 times. For our kids, and I will say this, our black and brown kids in Bayview Hunters Point, if they had an ACE score of 0, 3% of them had learning and behavior problems. If they had an ACE score of 4 or more, 51.2% of them had learning and behavior problems in school. They were more likely to have learning and behavior problems than not, right? And then when we look at our schools and we say that our kids can't learn in these, low-income kids in these inner-city schools, they can't learn, I believe that unless we are screening for and understand the impact of adversity, I refuse to believe that our kids can't learn, because of our black and brown kids growing up in Bayview Hunters Point, if your ACE score was 0, only 3% of them had learning and behavior problems. So you can imagine seeing this data and recognizing the profound impact on our population, the data coming out of the Kaiser population. We really had to think, for me, one of the things that I've shared with folks is that understanding this information has transformed my career. I couldn't not do something about this. And so in 2011, I transitioned out of my role as the medical director of the Bayview Child Health Center, and I became the founder and CEO of the Center for Youth Wellness, also based in Bayview Hunters Point, which works in partnership with the clinic. And the goal, the mission of the Center for Youth Wellness is threefold: is to prevent, screen, and heal the impacts of adverse childhood experiences. And the way that we do that, right, if we want to figure out, OK, how are we going to take this on, #1 thing that we have to understand is what is the mechanism, right? How does early adversity get under your skin? Just as we understand, we look at HIV and we say, okay, how are we going to solve this? Figure out what's the structure. It's a virus. Wait, no, it's a retrovirus. Okay, how do we develop antiretrovirals? It's kind of the same situation. Looking at the biology of how adversity is embedded was critical into creating our response. So I will give you all will indulge me in my little nerdy doctor moment here. But I think that it's really important, right? Essentially, what happens, this is what we know. The principal actor is the hypothalamic pituitary adrenal axis, which is your brain and body's fight or flight response. So imagine you're walking in the forest and you see a bear, right? Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland sitting here on top of your kidneys. And it says, release stress hormones, right? Adrenaline, cortisol. And so your heart starts to pound, right? Your pupils dilate. Your airways open up. Your blood pressure increases. And you are getting ready to either fight that bear or run from that bear. Now, if you were to think about it and say, should I fight this bear? Him, big, right? Teeth, claws, me, not so much. You probably wouldn't do it. And for that reason, your brain downregulates the thinking part of your brain, your prefrontal cortex, the part that's responsible for executive functioning and the thing that children need to be able to sit in class and learn. Your body downregulates your prefrontal cortex and turns up the part of your brain that responds to fear, the amygdala, so that's the fear response center, and another part of the brain that's called the noradrenergic nucleus of the locus coeruleus. That is the part of the brain that is responsible for a function that I call, I don't know karate, but I do know crazy, right? Imagine Raiders fans after a game, right? This is the within the brain stress activation center that pumps you up. And the other interesting thing that happens is that your body is figuring, okay, you're getting ready to fight a bear. You may take a couple of licks. So the other thing that this stress activation does is it turns up your inflammatory response, right? The bear may get you in a couple of places, so it turns up your immune system. And all of that is awesome if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this biological process is repeated over and over and over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health-damaging. Children are especially sensitive to this chronic stress activation because their brains and bodies are just developing. And this high doses of adversity affect the developmental trajectory of not only children's neurodevelopment, but also their developing hormonal systems and their developing immune system. And this is part of the reason why we see the dramatically poor health outcomes and dramatically increased risk for diseases of chronic inflammation, diseases like heart disease, cancer, COPD, in addition to very poor behavioral and social outcomes. So when we created the Center for Youth Wellness, and with this understanding, we created the organization with 3 pillars. We're built around, our 3 pillars are clinical, research, and policy. Each informs the other with a goal of transforming national practice. It starts with just raising awareness, sounding the alarm to say, you know what, this is a public health crisis and we need all hands on deck. Last year, our center analyzed the 4 years' worth of California statewide data on adverse childhood experiences. What we found was that statewide, 61% of Californians have at least one adverse childhood experience, and 16.7% of Californians have 4 or more adverse childhood experiences. Now, in counties, there were also some surprises in our statewide data, you know. In counties like the #1 county in the state of California. Anyone guess? #1 county. So that's what I thought. LA, another one? Fresno, that's what I was thinking. Butte County has the dubious distinction of having the highest prevalence of adverse childhood experience, and almost a third of the population has 4 or more adverse childhood experiences. Humboldt County is a close #2, right? So part of our work is just sounding the alarm, right? Because in order to be able to solve this type of dramatic public health crisis, we're not just going to solve it in the doctor's office, right? Like, I believe that there is a really, really important role for healthcare to play, and we are working on developing clinical protocols to be able to address this in the primary care home. But the response needs to be an ecological response. And so that's why raising awareness is #1. #2 is figuring out, okay, so now that people know about it, what do we do about it, right? In our center, we screen in partnership with the Bayview Child Health Center. We screen every child for adverse childhood experiences when they come through our door. And for those who screen positive, we have a multidisciplinary treatment team that uses current best practices, including home visiting, therapy, case management, to be able to respond and reduce the dose of adversity in the household and use best practices to heal what's going on inside that child. But in addition, we use promising practices as well, including mindfulness and biofeedback. These are things that the data is showing helps to stabilize that neurologic, hormonal, and immune axis, right, to be able to have better outcomes to attempt to prevent chronic disease in the long term. But the last piece of this work, in addition to sounding the alarm, in addition to developing these clinical responses, right, is figuring out how do we create a community that is responsive? How do we lay the foundation and the groundwork? And that requires all of us. We need an ecological model to be able to respond to this. You know, as I was getting up here and I was planning my comments for today, I was a little nervous. I said to my husband, you know, I'm talking to a business community, and I want to figure out ways to make it relevant for folks. And I said, well, you know, maybe I should show them the data about adverse childhood experiences and how it impacts disability claims, right? Or maybe I should talk about the data of, you know, adverse childhood experiences and how it impacts workers' comp, right? And I have that data, and you see me, I almost like went to the podium to get my notes. And ultimately what my husband said to me was, you know what? If they're interested in doing this work, they're gonna do it because it's the right thing to do, right? The folks in the room are gonna be interested in figuring out how to be part of the solution because these are our kids, this is our community, and ultimately, we're the ones who have to figure out how do we create a better, safer, more healthy world for the next generation. Now, we have been very fortunate to have leadership, to be able to be part of the Too Small to Fail initiative and see the leadership of Secretary Clinton and everything that has been done with the Clinton Foundation and Next Generation. But you know, one of the things that's interesting was I was chatting with someone backstage, and we were saying that there's a real risk there, right? You know, I really very, very strongly admire Secretary Clinton. She's running for president, right? And I love the fact that she is including adverse childhood experiences and toxic stress in her talking points when she is going around talking with folks. But the risk is that, you know, folks will see this as a political or a partisan issue, right? And that the science ultimately will be discounted. And I think that this is another place where the business community has a critical role to play. This is about your next generation workforce, right? And I think that we cannot allow politics to discount the science. This is a profound public health crisis, and this is something that every single one of us can contribute to making a public health level change. Now, one of the things I will say that I have shamelessly stolen from Too Small to Fail is really, what the business community can do to support families. On the ultimate basis, we recognize that creating a healthy community is something that every single one of us can be a part of. And particularly whether it's workforce policies that allow parents to have flexible schedules to be able to respond to their kids, whether it's paid family leave, whether it's, I don't know where you all are with mental health parity in providing coverage for mental health services. All of these are critical things that if you are joining the movement, if you are part of finding solutions, these are things that every single person in this room can do. Now, 30 years ago, right, when we looked at the HIV/AIDS crisis, the time from diagnosis to death, the mean time from diagnosis to death was 6 months, right? From the time of diagnosis, 50% of people were dead 6 months later. And today, on standard antiretroviral therapy, the life expectancy is more than 50 years. How did we get there? We got there from recognizing that a public health crisis requires a public health response, and that every single one of us, whether we're doing it I'm doing it in clinic, or whether we're doing it as community members, or whether you're even shouting over the fence to your girlfriend, hey, didn't you know that being in this situation or being exposed to early adversity can dramatically affect your child's health and developmental impacts over the long term? There is something that every single one of us can do. And I believe that 20 years from now, right? I'm not even going to wait for 30 years. 20 years from now, the child who is exposed to adversity and goes on to develop high blood pressure, heart disease, and stroke will be an anomaly. People will look at that situation and say, why didn't we do anything? There is so much that we could have done. But in order to get there, it's going to take every single one of us sounding the alarm on this public health crisis. I am grateful to the Bay Area Council for this opportunity to share with you about our work and the work that we do at the Center for Youth Wellness. And I look forward to your partnership in this movement. Thank you.